This area is often referred to as the heart of Toronto, the Church-Yonge corridor, but it's also a neighborhood that has seen the highest number of crisis calls and apprehensions under the Mental Health Act. Well, Toronto police have now released 7 years of data related to this from across the city, and what it shows is an escalating mental health crisis.
So we're looking at ways that we can divert the police ever having to go.
Between 2014 and 2020, the number of times officers responded to calls relating to suicide, overdoses, and distress jumped by more than 10,000 a year. The number of apprehensions under the Mental Health Act was also up by more than 4,300. Toronto police say this data is being released to provide more transparency and accountability.
So that the public could see what it was that we were doing, how we were interacting, and how we were intersecting with our mental health communities and calls for service.
According to the data, the Church-Yonge corridor, which is home to sprawling condos, the Eaton Centre, Ryerson University, Yonge Dundas Square, a safe injection site, and several shelters, is where officers have responded to the highest number of crisis calls. In 2020, police were called to this area more than 2,000 times, and 388 people were apprehended under the Mental Health Act, numbers that have doubled since 2014.
The streets are as crowded as when I first started in 2005. It was important for me to not only review this data, but to review it with somebody who's currently in a shelter hotel.
Doug Johnson-Hatlam is a street preacher with Sanctuary Toronto and has seen this crisis escalate firsthand.
There's a strong correlation between a higher number of calls and neighborhoods where there's this clear, strong desire to make invisible the most visible symptoms of poverty. Neighborhoods like Parkdale, the waterfront communities, Moss Park, are being subjected to intense gentrification. And other neighborhoods, like where Sanctuary is in the Church-Yonge corridor, tend to be where services exist.
And Doug believes there's important information missing from the data.
It would be good to know which ones of these calls led to police drawing their weapons, using tasers, even taking out their nightsticks, having to take somebody to the hospital.
For several years now, mobile crisis units have been assisting officers. In 2020, the specialized teams that include a mental health nurse responded to 7,500 of the tens of thousands of person in crisis calls, something Toronto Police is hoping to expand on.
To be proactive, to stop people from falling into the cracks, we really need the province to step up.
But Councillor Kristen Wong-Tam, whose downtown ward covers many neighborhoods seeing a high number of incidents, tells me this is a multi-layered issue with the lack of psychiatric supports, rehab spaces, and detox beds fueling the crisis.
It's really quite underinvested in for decades now, and all of that, all those significant challenges are coming to a head.
Now, starting tomorrow, the city is launching a pilot project with 20 additional mental health workers available to respond to people in crisis, and the focus will be right here in the downtown core. Wong-Tam tells me the hope is to expand citywide in the coming years. Shauna Hunt, City News.